My name is Tuppurainen, and I'm the Director of Spiritual Health and Pastoral Care at Providence Health Care. Spiritual health care is part of the allied health care for the holistic view for a patient or resident. So it provides insight for all parts of us, maybe some thoughts, emotions, reflections, in addition to the healthcare that is provided in a hospital setting. Spiritual care at Providence is provided by spiritual health practitioners, and they are part of the Canadian Association for Spiritual Care. So they have the master's degrees, and then they have educated themselves post-master studies. In addition to that, we also have a group of people like spiritual care volunteers who are part of the volunteer resources team, and they may work together with the spiritual health practitioner, for example, in a long-term care home, providing different programs, or for example, memorial services. In addition to that, we also have community spiritual care providers. They are like assistants for providing, for example, they are specialized in certain kind of community support, for example, in a particular religious interfaith group or faith leaders in particular religious faith. So why is spiritual health care important? Many of the people who come to the long-term care home or hospital setting, they are in transition. Maybe some changes they're processing. So spiritual health care is part of that time to allow to hear the questions, maybe the inner questions from the heart, and process them together. It is part of the journey together with the person, sitting alongside, listening their story. And it's not just for those who may say that I have a particular religious affiliation or preference. Sometimes we describe it as a talk to another person, feeling the presence of another person, the human talk, listening. It is also for respecting different cultures. So it's very beneficial for anyone who is in a situation processing maybe health questions in their life. So I'm very extremely excited to work at Providence Healthcare, thinking that we are an initiative. We are open for exploring new avenues for care, and art-based spiritual care is part of that. I'm also excited how open the community here at Providence has been for excellence, for stewardship, how we can be and bring in the best care for our patients.